Welcome back. About 400,000 people in the United States are affected by multiple sclerosis. MS is an unpredictable disease of the central nervous system, and it can cause debilitating symptoms. Here to tell us about the key findings of a new survey and how women with MS can take charge of their condition is neurologist Dr. Lori Travis, and from the nonprofit organization Can Do MS is Anne Lee Gilbert. Hi, ladies.
Hello. Good morning.
Great to talk to you both today. Let's talk about MS, what it is specifically. We know in Wisconsin there's a high rate of MS diagnoses, and how does it affect someone?
So MS is, as you said, it's a neurological condition of the central nervous system, and the central nervous system means the brain and upper parts of the spinal cord. It is an unpredictable disease because the body, in an autoimmune condition, the body attacks itself, and so the body is mistakenly attacking that lining, that myelin lining of the nerves, and so symptoms are really very diverse. You can have numbness in the hands that comes and goes. You may have loss of vision on one side that comes and goes. I think one of the big pushes is to make sure that people are being advocates for themselves and coming out and speaking to their doctor, or if you have a friend or relative with MS, having them come out and speak with their doctor, because there's a lot we can do these days.
Why do you think it's such a difficult diagnosis for someone to hear?
Sure. Generally, the onset of MS occurs between the ages of 20 and 40. And so particularly for women living with MS or women between those ages, they're really focused on career planning, on family planning, on their personal relationships. So on top of that, with the diagnosis of MS, it can be incredibly overwhelming during this critical time. Teva Pharmaceuticals and Can Do MS conducted a survey to 1,000 young women who are newly diagnosed with MS, and what we learned were that these lifestyle issues are really important to them, and 98% said that these issues were not addressed during their initial visits with their healthcare providers.
In terms of that age that you're talking about, those top concerns, how is it that you think they can be better addressed, or what can be done to help?
I think based on what we learned with these surveys, we've created some resources to really encourage that dialogue, and I think that's where the gap exists, is that there should be more open, more meaningful, and earlier dialogue between the patient and between their healthcare provider to be able to address all of these issues, no matter how sensitive or personal they might be.
The survey that you mentioned, what specifically was the goal of it?
So there were really several goals, and I think one of the biggest goals from my standpoint as a neurologist was making sure that we know that, MS, yes, it's a challenging diagnosis for many reasons, both challenging in terms of how to diagnose and treat, since there's so many good options, but also challenging in terms of making sure that people, that you as a person living with MS, or if you know someone living with MS, take that challenge and sort of run with it. And I say, part of what our goal is to bridge that gap so that doctors and their patients are having better communication about all realms of, including family life, everything that has to do with MS.
What current support and resources are there for specifically women who are diagnosed with MS?
Yeah, because of the really important information that we learned from the survey, Teva Pharmaceuticals and Can Do MS worked together to create 3 really key pieces of resources that can be found at mscando.org/women and MS. And these resources include a list of tips for newly diagnosed women of how they can live a healthier life with MS. It also gives a little cheat sheet of questions you can take to your doctor's office that address these issues so you can have that direct, open dialogue. And we also provided a guide for healthcare professionals so that they can also address some of these concerns during their visits. And all of this is really important tools and resources that patients and healthcare providers alike can utilize so they can have that really good dialogue.
It's wonderful. Thank you both so much for the open conversation about MS. We appreciate your time.
Thank you.